Would you believe me if I told you that prioritizing your mental health can have profound impacts on how your skin looks, rivaling that of skincare products? In today's video, we're going to talk all about how your emotional health, how your mental health feeds directly into how your skin looks, feels, reacts, and your overall quality of life, as well as total body health. I do find that there is a paucity of education, public awareness regarding the intimate link between your emotional well-being, your psychological health, and the health of your skin. The behavior of your skin is heavily influenced by both hormones and emotions. This can impact sebum output, making you oilier. It can impact transepidermal water loss, making you more prone to dryness, as well as symptoms of sensitivity, irritation, burning, stinging. And if you have an underlying skin condition, it's crystal clear in dermatology that there is a tight link between flares of a variety of skin conditions and psychological stress. Furthermore, certain psychiatric illnesses and disorders are closely associated with a variety of skin diseases, including depression, anxiety, obsessive compulsive disorder, post-traumatic stress disorder, and body dysmorphia, to name a few. Individuals under emotional distress, their skin recovers from problems a lot more slowly, and they're more likely to experience bouts of worsening of any underlying skin condition. Negative emotions can influence immune responses, and ultimately that can impact how our skin responds to environmental stressors, to insults, to damage, how quickly we recover from environmental insults that otherwise would damage our skin and contribute to premature skin aging, as well as flares of underlying skin conditions. Furthermore, when we're under intense psychological stress, or if you have an underlying psychiatric illness, a lot of times it leads people to have other disruptions in their life, namely on their sleep. And when our sleep is disrupted, we're not getting good quality restorative sleep, it leads to more water loss from the skin, more dryness, more irritation, heightened sensitivity. It doesn't give your body adequate time to recover and to heal the barrier, and therefore you are more vulnerable to oxidative stress in the skin that damages critical structures and sets the stage for premature skin aging, as well as flaring of a wide array of skin conditions. Don't underestimate how valuable a mental health tune-up can be for not just your skin, but for your total body. The skin is a window into what is going on internally, and that includes your psychological health. We are now more than ever bombarded with information overload. Our schedules are packed. We continue to extend ourselves, and that puts a lot of stress on us. It compromises our sleep schedule. We have all of these devices that we're looking at all the time that disrupt our sleep-wake cycle. Staring at screens makes it difficult for us to properly fall asleep, for our brain to transition into sleep mode. And as a result, we're just not recovering. And that all feeds into the way your skin looks, reacts, and feels, and your psychological well-being. When you're sleep deprived, well, your emotions are not as easy to control. You're a lot more short-tempered. Your focus is poor. You're inattentive. This can actually compromise your productivity at work and your interpersonal relationships. And when many people are stressed out, they often turn to substances like alcohol. Unfortunately, alcohol, it impacts your sleep negatively, and it can have profound negative consequences to your overall mood. It is a depressant. And we know that people who consume alcohol in excess, they show the signs of skin aging at a much faster and more significant rate. Deeper wrinkles, more sallow skin. Easy to brush aside stress is just this common thing that everyone deals with. But by not addressing it head on, early on, you can really start to go down a very slippery slope where sleep is impaired, quality of life starts to suffer, and maybe you turn to alcohol or some other maladaptive behavior. You'll also see this in people who are under a lot of stress and maybe have a primary skin condition, but they start picking their skin, pulling at their hair, plucking at their eyebrows, their eyelashes, pulling at their fingernails, biting their fingernails. These are all habits that can show up and be heightened in situations of emotional, psychological stress and underlying mental health problems. It also can impact your fingernails. When some people get very anxious, inadvertently start rubbing their fingernail like this, over time, it starts to lead to what's called a habit tick deformity in the center of the nail, and that takes a long time to grow out and improve. Stress impairs your moisture barrier, makes you more prone to losing water. You're a lot more vulnerable to symptoms of itch. And itch is a skin symptom that starts to become very maladaptive in the cycle of your emotional well-being, because itch is very uncomfortable to deal with, and the compulsion to scratch, it's just human nature. It's like when someone blows in your face, it's just natural to blink. When these itch signals are released in the skin, it's just natural to scratch. However, unlike blinking, scratching is counterproductive. Scratching further impairs the health of the skin barrier. It leads to the release of more itch signals. It thickens the skin in an abnormal way. And over time, you develop this little nidus of persistent itch. And people, as a result, chronically scratch that. Just as alcohol can disrupt your sleep, scratching behaviors really can impair sleep quality. Getting good control of the skin condition and the psychological triggers of stress can actually make a huge difference, not only for the skin, but for these patients' sleep quality and their subsequent performance in day-to-day life and their ability to get their schoolwork done. I mean, it really can be transformative. So it's easy to say, manage your stress, prioritize your mental health, but how exactly do you do that? Therapy can be actually very beneficial, not only for the mental health piece of these skin conditions, but for improving the symptoms and clearing up the skin condition. I know it sounds dramatic, but there's actually good evidence that cognitive behavioral therapy can impact a wide array of skin conditions. Cognitive behavioral therapy is a method of treatment that recognizes problematic dysfunction in thoughts and works to develop strategies for the individual so that they can change those thoughts and subsequent behavior patterns the next time they are in the face of that particular trigger. It's based on the underlying premise that challenging situations elicit unhelpful thinking and problematic behaviors. So for example, maybe you get stressed out. As a way to self-soothe or cope, maybe you pick at your skin. Cognitive behavioral therapy can help an individual identify those particular patterns and help them develop strategies around those behaviors to better cope, and ultimately that can have a huge impact. Cognitive behavioral therapy basically helps to increase your self-awareness, and it also helps to reshape negative thoughts and emotions so that the next time you're exposed to a particular trigger, you're better able to identify that and redirect. It really helps you to cultivate more effective responses in the face of subsequent trigger exposure in the future. Now, I want to make it clear, I'm not a behavioral health expert. I'm not a psychologist or psychiatrist. And I also want to make it clear that while cognitive behavioral therapy shows a lot of promise for helping numerous skin conditions, it's not necessarily the best approach for everyone. But at the end of the day, it is important to take your mental health very seriously. In some cases, cognitive behavioral therapy plus medication may be necessary to get optimal responses. Having a skin problem can really be very socially isolating for a lot of people, especially when it occurs in like a sensitive area. It can have negative impacts on maybe your sex life, or if you have a skin condition that is easily visible, it may just make you feel poorly about yourself. And even if you are on standard treatments for that skin condition and you're actually getting good responses from them, it may not be enough to alleviate how you feel about yourself. There are a lot of medications that we use in dermatology that can get somebody 90% clear, 80% clear, but sometimes it clears up everything but the one spot that really bothers the person the most. And so addressing the mental health piece of things can really round out in a more holistic manner how one goes about approaching that patient's skin problem. If all we're doing is treating with medications that clear 95% of the skin problem, but it's that 5% that remains that's actually what bothered the person the most, it's much less likely that that person is going to stick with the treatments long term and that they're going to have ongoing continued benefit. Having that additional behavioral piece in there can also make a huge difference, especially if it's something that's driven by scratching behaviors, poor sleep, dysfunction in the skin barrier, maladaptive behaviors to cope. All of these things, if they're addressed, it actually can make a tremendous difference. But don't just believe me, there is science to support the use of therapy for a wide array of skin diseases. Most of the research is going to be on psoriasis. Psoriasis is a chronic inflammatory skin condition We know that high stress is positively associated with flares of psoriasis, and there's a biologic mechanism there. Again, I want to emphasize that this is not just guilty by association. There's a true biologic mechanism there whereby hormones that get released in the face of stress, they are present in the skin of people who have psoriasis, and they are key drivers of the inflammation that leads to the skin spots of psoriasis. And you can see those particular neurohormonal mediators. The levels of those are increased in patients with psoriasis when they're under stress in their skin lesions. And when the stress is under control, well, then that can calm down and that can lessen and the skin can improve. Cognitive behavioral therapy has been shown to be really effective for a lot of patients who have psoriasis in terms of getting their skin clear. The medications that we use to treat psoriasis, whether it be the fancy biologic medications that you see commercials for all over on TV, well, at least here in the US where we have drug commercials, or the topical medications, or treatments like narrowband UVB phototherapy. These treatments, they all treat the skin problem, but they don't address the underlying emotional component that can flare the skin problem. Studies show nicely, and it's obvious clinically that patients who are able to access therapy for their emotional health, they often have better responses to their treatments, and they're also better able to stick with them. Therapy can also help people to stick with their medications. It helps them start to see that things are getting better, their overall quality of life is better, maybe their motivations are improved, they're more motivated and more likely to stick with their medications. I did a video a while ago on how acne negatively impacts mental health and quality of life, especially in adult women. So check that video out. But one response to acne in the face of stress that a lot of people develop, a coping mechanism if you will, is skin picking. Skin picking disorder. I have quite a few videos here on YouTube talking about this issue. I've got tips on how to identify your triggers, keep a journal, keep your hands occupied with something like a craft or a stress ball. Those barrier patches, I really like the Mighty Patch, for example. As a matter of fact, YouTube has this new shop feature where if you click on that little bag, this should pop up. I'll see if I can't put the Mighty Patch in there so you can read more about it. But all of these can help, but seeking out professional mental health support can make a huge difference for this disorder. And in some cases, medications may be necessary. Other body-focused behaviors like pulling at your hair, otherwise known as trichotillomania, pulling at your eyelashes. Sometimes this is just done absent-mindedly, but in the face of stress or some other emotional trigger, and going through the therapy process to identify and intervene on this can make a huge difference, because when we're talking about skin picking disorder, for example, it's not just like a little scratch here and there. It turns into a full-blown problem where, in the case of acne, it aggravates the acne, leads to scarring. With the picking, you can introduce bacteria into the skin that lead to infections, and the acne treatments are not very likely to work so long as the individual is picking at the acne, because that just creates a lot of inflammation and problems there that subsequently can lead to really stubborn post-acne hyperpigmentation and scarring. For people who have atopic dermatitis, cognitive behavioral therapy can help in minimizing itch and scratching behaviors, because again, that stress response, it really can drive a lot of barrier dysfunction. There's a specific type of cognitive behavioral therapy shown to be helpful in eczema called habit reversal training that can help those individuals break the itch scratch cycle, which can be huge in eczema. It can make all the difference actually for some people. I don't want to overstate it, but it could make all the difference for some people in terms of the severity of their skin condition, so much so that it can make the difference between them having to go onto a stronger, more expensive medication. This itch coping training can be so successful that research shows that patients who go through it and have success, they end up relying less on having to come back to the dermatologist multiple times. They end up needing less topical steroid creams. They're less reliant on topical steroid creams because they're having presumably fewer flares. And they end up needing fewer itch relieving medications. Not to mention, there are a wide array of skin problems that really impact people negatively in terms of their quality of life. Alopecia areata, it's an autoimmune hair loss condition, where the immune system just decides to attack your hair follicles and you develop bald patches. In many cases, the hair regrows without any intervention, but in some cases, it becomes very extensive. It can involve the entire scalp, the eyebrows, the eyelashes, pretty much any hair on the body can be affected by this, and it can really have a hugely negative impact on someone's overall quality of life. Losing a hair is quite a traumatic thing to go through. It's very distressing, and that can really have a negative impact on someone's quality of life. They may not even realize how much of an impact it's having until maybe they seek out mental health support. Vitiligo, autoimmune attack on the pigment cells, leads to loss of skin color in patches, porcelain white in affected areas. This can really have a huge impact on people's overall quality of life. It can impact the hands, around the mouth, I mean really any body site. And unfortunately, a lot of the medications, they're effective, but they're not always as effective at getting the repigmentation in areas like the hands or around the mouth. So it comes back to, again, medications, they treat things, but sometimes they miss that 5% that actually is what really bothered the person to begin with. All right, y'all, that's what I wanted to say for today's video, all about how prioritizing mental health and mental health resources can end up paying off dividends in how your skin looks and feels and your overall quality of life and health. Prioritizing your mental health, it may sound silly, it may sound like something that you just don't have time for, but it's really a priority area. In today's lifestyle, we have a lot of things distracting us, making us feel down about ourselves. Social media, which is just a massive false theater, doesn't paint reality, can make people feel really negative about themselves. Poor body image, poor self-esteem, see things online that they think are the way the world is, when in reality, it's just a highlight reel. People don't actually look like that. They have filters on. Social media can really put a lot of pressure on us. In today's financial climate, a lot of people are significantly stressed, worrying about how they're going to pay their bills, feed themselves and their family, and don't underestimate how much that type of stress can really start to creep in on your health, including the health of your skin. It's more than just the cosmetic benefit, of course. Health is key. I mean, health is really where it's at. I hope you guys enjoyed this video. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.